Are you thinking of having a breast implant or liposuction? At Vanidades, we have the best plastic and reconstructive surgeons. Brazilian butt lifts under $3,000. Breast implants from $2,400. Tummy tuck starting at just $3,500. Lipo with laser from $1,200. And much more. Call now for a free evaluation. Varicose vein treatments. Hair restoration from $1.50 per graft. Stretch marks, scars, hair, and pigment and lesion removal with laser. Call Vanidades now. 305-262-6070. Broward 954-474-8586.
Without a doubt, nature is amazing. It can inspire us to challenge ourselves. This may be your story. It's not impossible. It's what we do every day.
Want to increase a cup size or two? Our board-certified surgeons specialize in breast implants from $2,800, lipo with laser $1,800, body hair laser treatments $2,000, tummy tuck from $3,500, 305-262-6070.
Hello everyone, and welcome to another edition of Vanidades Cosmetic Surgery Show. We are learning about the latest developments in aesthetic medicine offered by Vanidades Cosmetic Surgery and their plastic and reconstructive surgeons. Today's special guest is cosmetic surgeon Dr. Anthony Hasan. Doctor, I'm so happy you're with us today.
Thank you very much. Thank you for having me here, Debbie. Appreciate it.
Absolutely. Today, we have the honor of having Dr. Anthony Hasan in our studios. He is a cosmetic and reconstructive surgeon and one of the most talented at Vanidades Cosmetic Surgery. He has the following credentials: Diplomat of the American College of Cosmetic Breast Surgery, Diplomat of the American Board of Dermatology, Diplomat of the American Board of Cosmetic Surgery, Diplomat of the American Society of Mohs Surgery, Fellow of the American Academy of Dermatology, Fellow of the American Academy of Cosmetic Surgery, Fellow of the American Academy of Cosmetic Breast Surgery. Dr. Hasan, your credentials are evidence in the preparation in the field of plastic and reconstructive surgery, and from my point of view, it transmits a sense of security for the patients that are looking for a doctor who can deliver a lifelong dream of cosmetic and reconstructive surgery. So let me ask you, what gives you the greatest satisfaction to be a cosmetic and reconstructive surgeon?
That's a good question. I would say, honestly, the best satisfaction I can obtain is really putting a smile on my patient's face. Knowing that I gave them what they wanted,
right,
artistically is a great challenge for me, and to improve their self-esteem and to give them what they've earned to have for such a long time is quite satisfactory for me.
Like I was saying, it's a lifelong dream for many.
Absolutely. I mean, growing up, I've always enjoyed artistic things. Matter of fact, in high school, I had art scholarships, but the direction I went was obviously medicine. But I still enjoy that artistic side, and again, being able to award that patient with that satisfaction, that thing that she truly wish to have is uncomparable to anything else that I can honestly wish to have.
That's a great answer. You can see you really love what you do.
Yeah, I truly do.
So let me ask you, what is TUBA, or Trans-umbilical surgery? Can you explain what that is and who would be a candidate for this?
Yeah, the Transumbilical Breast Augmentation, that's exactly what TUBA means,
okay.
TUBA. It's a beautiful procedure. It originally started in Texas. There was a surgeon there that was doing abdominoplasties, and he was actually applying the implants via the tummy tuck scar. So obviously it evolved into where trying to go through the belly button and still taking advantage of the abdominal area.
Okay.
But it wasn't until my partner that I had in California by the name of Peter Chesky, him and I were some of the first pioneers in really developing the transumbilical breast augmentations. Matter of fact, I was the third person in the state of California doing the transumbilical, and it really grew from that point on. A lot of the instruments that we use today were designed by him and I So to really facilitate and make the procedure even easier. So we've done hundreds, literally thousands of these, and
over 2,000 to be exact.
Yes, that's right. And we've had an enormous amount of success with it, and it's a great procedure.
So what would you say is the advantage of this procedure over other kinds?
Well, there's a number of advantages, but really it's patient selection,
Okay.
like any procedure.
Right.
Any breast augmentation really comes down to patient selection. But there are some advantages. If I can, I would like to illustrate it if I can draw.
Oh, that would be great.
Yeah.
Yes. I think we have a board underneath here for you, and there should be some pens right there. Yeah, that would be a better way for us to kind of understand.
Yeah. The transumbilical breast augmentation is really trying to take advantage of a natural scar. When we're all born, we all have an umbilical cord. And that umbilical cord eventually falls off, and our caring, loving mothers take care of that wound. But in reality, that belly button that we cherish so much today is actually a scar. So by being able to take advantage of a scar, we don't actually have to form new scars. Naturally, we have breast tissue, and behind that, we have the pectoralis. So what we're trying to do, we're trying to make a hidden incision inside the belly button.
Okay.
And we travel the implant right underneath the skin and placing the implant behind the muscle. One of the major advantages, obviously, we don't have to even touch the mammary tissue. And that's a great advantage to a lot of patients. Another advantage is that people are concerned that you're going to damage the nerve, the sensory nerves to the nipple. Mm-hmm. You're at less risk of that by going via the transumbilical.
You're showing that it's actually not even, you're not touching that area,
Absolutely,
you're going behind.
Absolutely. But I would say the overall advantage would be to say that the patient can honestly look at herself in the mirror and say, I have no scars. We're taking advantage of an old scar, the original scar that we had when we were, when we were born. And to take advantage of that and not have to incite or cut any virgin skin is probably a great satisfaction to me. Yes. Because again, we don't know who's going to scar well and who will scar bad. For example, we do know that there are some people that are predisposed to bad scars. People of Asian descent, African descent, they tend to have more keloids, hypertrophic scar. Also, post-inflammatory hyperpigmentation, darkening of the area. Mm-hmm. And that itself is very, very hard for some patients to really have to deal with post-operatively. They want to come in, have a result that they can be pleased of. And that's one of the advantage, again, to the transumbilical, is that you're not going to see any cuts, any bruising, any marks that can lead to later problems as far as aesthetics are concerned.
It's a huge advantage.
I think so. Another advantage that I like about this procedure is that at the end, you're talking about one little cut inside the belly button. Everything else is in a series of two, if you notice. If you go under the breast, it's a series of two. If you go around the areola, series of two. Even if you do the axillas, it's a series of two. So again, taking advantage of the belly button, again, it's our original scar is a major advantage.
How long does this surgery take?
That's a good question. It really comes down to the expertise of that surgeon. Okay, there is a learning curve to this procedure because you're trying to augment a breast via a belly button, which is a small little hole, in a substantial amount of distance compared to just going directly through the areola. But once the surgeon has gone through the learning curve and mastered the technique, you can actually do it in about 30 to 40 minutes.
Wow. Okay.
Which is a major advantage.
Yes.
Yeah, because again, most of the problems when we undergo any kind of surgery is anesthesia. And if you can get that patient in as quickly in and out is a major advantage to the patient.
One of the questions that we get very often on our website, myvanidades.com, is what is the recovery time? Everybody wants to know that. So can you kind of touch on that and what the recovery time would be?
Absolutely. The recovery time, again, it kind of goes back to the question that we just had a minute ago. If we can shorten even the amount of the time it takes to do the actual surgery, you're exposing the patient to perhaps less inflammation, swelling, and that would also transfer into the recovery phase. There's been a couple anecdotal studies, not necessarily studies documented in medical journals, but overall we've noticed among myself and many of my colleagues and in many of these medical conferences I think that the period of recovery is probably actually shortened compared to that of a traditional breast augmentation.
Wonderful. Well, thank you. And remember, everyone, Vanidades Cosmetic Surgery has 3 convenient locations in Miami, Hialeah, and Broward. All 3 locations have state-of-the-art surgical rooms and are certified by the Health Department of Florida. For your free consultation with Dr. Anthony Hasan, call us now at 305-262-6070 or in Broward at 954-474-8586. We have medical assistants who are waiting to answer your questions and sign you up for a complimentary free consultation with Anthony Hasan. Call us now at 305-262-6070 or in Broward at 954-474-8586. We have medical assistants who are waiting to answer your questions and sign you up for a completely free consultation with Dr. Hasan. We have offices in Miami, Hialeah, and Broward. Call now. We have medical assistants waiting for your call at this time. 305-262-6070 or 954-474-8586. Let's take a short break, and when we return, we'll continue our cosmetic surgery conversation with today's special guest, Dr. Anthony Hasan, a board-certified cosmetic and reconstructive surgeon.
Are you thinking of having a breast implant or liposuction? At Vanidades, we have the best plastic and reconstructive surgeons. Brazilian butt lifts under $3,000. Breast implants from $2,400. Tummy tuck starting at just $3,500. Lipo with laser from $1,200. And much more. Call now for a free evaluation. Varicose vein treatments. Hair restoration from $1.50 per graft. Stretch marks, scars, hair, and pigment and lesion removal with laser. Call Vanidades now. 305-262-6070. Broward 954-474-8586.
Without a doubt, nature is amazing. It can inspire us to challenge ourselves. This may be your story. It's not impossible. It's what we do every day.
Want to increase a cup size or 2? Our board-certified surgeons specialize in breast implants from $2,800, lipo with laser $1,800, body hair laser treatments $2,000, tummy tuck from $3,500, 305-262-6070.
Welcome back to the show. We are joined by Dr. Anthony Hasan, and the next question I have for you that I'm sure many of our viewers are wondering, is this procedure safe?
Absolutely, it's safe. It's again, it depends on the experience of the surgeon. Like any surgery can have its risk, and all surgeries, as a matter of fact, have risks. But overall, since this procedure has been, I would say, easily 20 years in practice now, it has had an incredible success rate. Right. Matter of fact, the level of complications that we've seen in overall breast augmentations have been less in the transumbilical. We have less hematomas, less infection, less pretty much everything. And again, remember the procedure I said it was 30 minutes.
Right.
So that itself is a major advantage. You know, if you can get the patient in and out, it's safer for the patient.
So, and like you were saying, it's been around 20 years, so people might be wondering, oh, I'm just hearing about this. It's
right.
not a new procedure.
It's not a new procedure, but it has been growing in popularity very quickly. Again, I mean, the direction that most people are going today in all forms of aesthetic surgery is the limited amount of scars. Everybody wants a big result with the minimal amount of scars.
Absolutely.
And this basically kind of feeds into that kind of direction that aesthetic surgery is going. You're getting the same results that we traditionally have seen with the periareolar or any of the other 3 techniques, but with the minimum amount of scars. So it's a beautiful procedure, as I said.
If you have any common questions regarding recovery time after a surgery, how a surgery is performed, or before and after care, please visit our website at www.myvanidades.com, where you can review Dr. Anthony Hasan's credentials and find lots of other interesting information like our 3D cosmetic surgery animation and education library customized exclusively to our practice and for your enjoyment and education, free of charge to our patients.
Are you thinking of having a breast implant or liposuction? At Vanidades, we have the best plastic and reconstructive surgeons. Brazilian butt lifts under $3,000. Breast implants from $2,400. Tummy tucks starting at just $3,500. Lipo with laser from $1,200. And much more. Call now for a free evaluation. Varicose vein treatments. Hair restoration from $1.50 per graft. Stretch marks, scars, hair, and pigment and lesion removal with laser. Call Vanidades now. 305-262-6070. Broward 954-474-8586.
Without a doubt, nature is amazing. It can inspire us to challenge ourselves. This may be your story. It's not impossible. It's what we do every day.
Want to increase a cup size or 2? Our board-certified surgeons specialize in breast implants from $2,800, lipo with laser $1,800, body hair laser treatments $2,000, tummy tuck from $3,500, 305-262-6070.
Welcome back to the Vanidades Cosmetic Surgery Show, and we are joined by cosmetic and reconstructive surgeon Dr. Anthony Hasan. Doctor, many times on our website we get a lot of questions and they go unanswered sometimes. So would you mind if we asked you a couple of these questions? Okay.
Absolutely.
Let's go through our website. All right, here's one. I'm 5'5" and weigh 135 pounds. After my pregnancies, I feel like I've lost some breast volume and I'm thinking of breast implants. How do you decide what size is appropriate for breast implants?
It's a good question. I think one of the most important things is determining whether this patient is going to need a lift or just an augmentation. Because a lot of the patients that go through pregnancy, again, it depends a lot on how they were prior to being pregnant as well. So if they feel that they're a little droopy, and we do some measurements,
each case is going to be different.
Absolutely, based on the numbers and the measurements, we will determine what type of candidate is this patient. But overall, many of the patients who had children, one of the main complaints is that the top pole of the breast has this kind of scooped out appearance, and sometimes with simply an implant is more than sufficient in filling that out. But again, they will need to be evaluated and determine whether we do a lift in addition to an implant or simply an implant.
Okay, wonderful. Ready for another?
Absolutely.
Okay. What is the difference between a fat transfer and buttock implants, and which one do you recommend?
Well, both of them are a form of augmenting the buttocks, the gluteal area. Okay. There are a lot of recent drive in transferring one's fat into the buttocks area. That's like the latest thing now. You've heard of the Brazilian butt lifts and all these other forms of augmenting the buttocks using one's own fat. One of the latest things now in using one's own fat is actually using plasma-rich, platelet-rich plasma. PRP. In what they do, they actually extract blood product from the patient, they spin it, and then they prepare this blood product. It forms almost like a glue, and they mix this with the fat. It releases all these growth factors, and it almost ensures that the fat has a better survival rate. So that's one of the latest things now in the movement of butt augmentation,
Okay.
buttocks augmentation.
As for your recommendation?
I think that's the direction where most people are going now. Okay. It's a beautiful procedure, but it's not for everybody, because, and this is kind of funny that I have a lot of patients come in for a fat transfer, and they're 119 pounds, and and I tell them, I would love to do it, but you just don't have any fat.
Go out and eat some pizza, come back a little later.
So in those are the cases,
Right.
then they have no choice. Then we go with the implant. It's a little uncomfortable, but if they're really dreaming of having that perfectly round buttocks, then
Right.
then that's probably the direction. They would have to go implant.
We encourage all of you watching to check out the Vanidades Cosmetic Surgery website, www.myvanidades.com, where you can review Dr. Hasan's credentials and find lots of other interesting information, like our 3D cosmetic surgery animation and education library, customized exclusively to our practice and for your enjoyment and education, free of charge to our patients.
Are you thinking of having a breast implant or liposuction? At Vanidades, we have the best plastic and reconstructive surgeons. Brazilian butt lifts under $3,000. Breast implants from $2,400. Tummy tucks starting at just $3,500. Lipo with laser from $1,200. And much more. Call now for a free evaluation. Varicose vein treatments. Hair restoration from $1.50 per graft. Stretch marks, scars, hair, and pigment and lesion removal with laser. Call Vanidades now. 305-262-6070. Broward 954-474-8586.
Without a doubt, nature is amazing. It can inspire us to challenge ourselves. This may be your story. It's not impossible. It's what we do every day.
Want to increase a cup size or two? Our board-certified surgeons specialize in breast implants from $2,800, lipo with laser $1,800, body hair laser treatments $2,000, tummy tuck from $3,500, 305-262-6070.
All right. This one is from a gentleman. Can men with large breasts reduce the size with liposuction or surgeries?
Again, that's another one of those cases that you have to evaluate the patient, because men can have breast tissue, and in addition to fat tissue, and you would have to determine what type of tissue this individual has. Breast tissue in a man is called gynecomastia. And many times this tissue is a little more, it's a little harder, and it's harder to be able to be extracted via a cannula, liposuction. So you would have to sometimes open and actually remove this tissue.
Okay.
But as we age, as men age, we do accumulate, our metabolism gets slower, and we do accumulate fat. And one of the areas where we do accumulate fat is in our chest area. So liposuction for these patients are excellent. They get great results, and they're very happy. But again, they need to be evaluated to make sure they don't have any kind of gynecomastia, where again would need to probably be removed more open technique rather than a closed technique with a cannula.
Okay, but definitely come in, talk to you, and see which way is
absolutely.
best. Okay. Here's another. I'm a 40-year-old woman who has given birth recently. How long would I have to wait before I have surgery?
Many of my colleagues would say a minimum of 3 months, and some will say as far as a year. I would say the average is about 6 months. Again, the most important thing, though, is speaking with the patient and getting an understanding where is she in her recovery. Okay? Because different women recover or go back to their original state slower and some faster. The idea is you do not want to do surgery on a patient that's still in the transition of changing back to where she was prior to being pregnant.
Right.
You want her to fully recover from that phase, and then from that point on, she would have obviously a much better result once she's gone through that phase.
Okay. How do you perform a fat transfer, and who would be a good candidate for that?
Again, that would be similar to the question we just had a minute ago. It's basically you start off like any liposuction. Hopefully, you can harvest enough fat from a person that you can do that. Once we harvest this fat, we do it in a technique where we protect the fat cells as to the best of our ability, because again, it's not simply extracting fat, but extracting quality cells. Once we have that fat, you can either inject it directly into the area that needs to be augmented, whether it's facial or buttocks, or you could prepare it, like I said before, with a PRP substance.
Okay. What type of liposuction techniques are you using in this surgery?
That's a great question, because the industry of liposuction has expanded enormously over the past 5 years, and it seems like just when you got into one technique, there's a whole new one just came out. But I still strongly feel that it really comes down to the surgeon's experience, because the machine won't make you a better liposuction surgeon.
Right.
It's the experience behind the cannula.
Absolutely.
And that's the most essential thing. So there are a number of techniques, they're all good, but it really comes down to who's doing that liposuction and their artistic eye in really giving a great result to that patient.
Okay, now I have a personal question. What surgery do you perform most of the time?
You know, I love body contouring. It's my way of like sculpturing. Mm-hmm. You know, I feel like
it goes back to your creative side that you were telling
it really
us.
does. It really does. It makes me kind of have that Michelangelo sculpturing a piece of marble. Yes. So I really do enjoy body sculpturing, whether it's breast, body, fat transfer, whatever it takes to give that person that ideal look that she's looking for. But I also enjoy a lot of the facial plastic stuff as well. So I really don't have a preference. They're like your kids. You know, you don't have one favorite. You know, they're all beautiful procedures, and it really comes down to selecting the right candidate and giving that candidate the best result.
Wonderful. Well, Dr. Hasan, thank you so much for being here today, answering all of our questions, even our website questions. We really appreciate it.
My pleasure. Thank you for having me, Debbie.
And thanks for all of you for joining us today and giving us your time. We'll see you soon. Bye-bye. Yeah, this was really good. There was a lot of other...
Are you thinking of having a breast implant or liposuction? At Vanidades, we have the best plastic and reconstructive surgeons. Brazilian butt lifts under $3,000. Breast implants from $2,400. Tummy tuck starting at just $3,500. Lipo with laser from $1,200. And much more. Call now for a free evaluation. Varicose vein treatments. Hair restoration from $1.50 per graft. Stretch marks, scars, hair, and pigment and lesion removal with laser. Call Vanidades now. 305-262-6070. Broward 954-474-8586.
Without a doubt, nature is amazing. It can inspire us to challenge ourselves. This may be your story. It's not impossible. It's what we do every day.
Want to increase a cup size or two? Our board-certified surgeons specialize in breast implants from $2,800, lipo with laser $1,800, body hair laser treatments $2,000, tummy tuck from $3,500, 305-262-6070.